So today we're going to talk about vulnerable populations. To define a vulnerable population is when their health and healthcare problems intersect with social factors, including housing, poverty, and inadequate education. Vulnerability results from developmental problems, personal capabilities, disadvantaged social status, inadequacy of interpersonal networks and supports, degraded neighborhoods, environments, and just the complex interactions of all these factors over the course of their lifetime. A local issue that affects a lot of vulnerable population is the opioid epidemic. OD deaths are worse in poor and rural areas. This affects children. Thousands go into foster care because of parental drug use. And unfortunately, a rise of children have gone in recently because of parental death from overdose. Social workers can help by help by team-based care models, integrating family into support, and being culturally relevant to the client. And a meso help address social determinants of the health, different things in the community that may be degrading their health, and adding to the fact that they have an addiction, supporting integrated health care where appropriate, and in a micro standpoint, focusing on federal policies, they must reflect the vital role of social workers in helping bridge the gaps in care in which the individuals and families that are fighting the substance use disorders often encounter. Social workers here are very key to ensuring individuals transitioning from treatment to recovery do not fall through the cracks. Regionally, there are natural disasters. I'm from Houston, and down in Houston during Hurricane Katrina, unfortunately, African Americans and the elderly had inadequate resources, inadequate networks, and the community was not prepared. In California, I guess I'm from Arizona, the fires affected record-sized unsheltered homeless population and farm workers because of the smoke, the lack of transportation, and lack of ability to communicate with the volunteers and workers through the evacuation. This was a problem during hurricanes as well. During one of the hurricanes that's in Houston, they had the evacuation routes, and they changed them right before the hurricane came. And for vulnerable populations that don't have access to, networking or computers or anything like that, they definitely would have been out of the loop. And it did cost a lot of people a lot of lives. Some people got stuck. Some people were just stuck in their houses. Those who are socially isolated and in poverty are hit the hardest during these disasters because of that, because they have a difficult task of recovering from the lost property, the health issues that arise from the mold and fire and smoke and everything like that. The social workers can help micro and case finding, networking with people that are coming into getting help and seeing if there's other people that they haven't heard from or, that might need help. Management to educate those in need about services and connect to them before it even happens. And also trying to remove any stigma related to getting help. Because especially in disasters, even if you're not a vulnerable population, it can be a difficult time. Meso, organizing more community involvement in emergency services. This is something great about Houston, is I just say that overall the community does get together and help a lot of people and helps wherever they can. They had athletes and rappers out there helping however they could. It was great. But having more communities do that will help a lot more vulnerable population. Creating a simpler access to outreach centers, having more available in different areas that, like rural areas that are harder to get to, making them more geographically accessible. Continued research into organizational coordination, like the one the UCF did during Hurricane Irma in 2017, where they studied how organizations worked with each other to aid undocumented immigrants and continue to find gaps in policies and procedures and work together to fix them. Nationally, I think that healthcare is a big issue that affects everyone, including vulnerable populations. Making sure that children have continuation of services in the welfare system. Social workers affect helping in decision making and determining the ability of the individual for independent decision making and self-care. Veterans and homeless, creating centers such as like the homeless medical home by the VH program, having homeless patient aligned care team, on-site showers, laundry, food pantries, and other food assistance, and access to transportation. Those all lead to reduction in ER use and hospitalization for veterans. The Society for Social Work Leadership in Healthcare allows networking, has mentoring, conferences and workshops, job opportunities and education for students and new professionals. Having something like that does help with a macro focus on healthcare. Internationally, I think the biggest thing is climate change that is affecting us. It's a massive global issue that is in need of immediate attention. It's evident that the issue of climate change falls under social work because it disproportionately affects marginalized populations and has significant negative impacts on the health and well-being of individuals and communities. Social workers can help by being researchers, educators, clinicians, and community members by using the use of social justice lens and how we can get together and fix this. Orientation towards policy, recruitment of those from areas affected by the natural disasters and climate changes to be experts and frontrunners for the change of global perspective on this issue. That would also give them empowerment. Community organizing skills, wider environmental, social movements against climate change. And I think the biggest thing that this would help internationally is having a person-environment perspective. I think that would help a lot of people see how these people are being affected by the climate change. And this is how social workers would help empower vulnerable populations and different issues that they have.